There's no doubt that the COVID pandemic has affected pretty much every research laboratory worldwide, but I think it's important to stress that most of these changes were directed towards the benefit of COVID-19 patients and the support of healthcare systems and the governments. The rapid response from many research centers allowed for the quick implementation of reliable diagnostic tests and groundbreaking work on potential treatments and vaccines for the new coronavirus. Still, many researchers working on more distant topics, and this includes myself, were faced with having to transition to working from home, at least in the beginning of the outbreak. We had to adapt to this new reality and reinvent new ways of carrying out with our projects. And in our case, this involved engaging in teleconference calls, discussing theoretical problems, redirecting laboratory work towards writing review papers and novel grant applications. We also took this opportunity to explore how we could make ourselves more visible to the general public. So it's been rewarding in a different sense. And a couple of weeks into the quarantine, our institute and faculty also came together to implement a diagnostic unit here in our facilities. So I've been also working since then on that front. So all of this to say that I don't really believe that the quality of research being performed in most parts of the world has decreased. The outputs might have changed a bit, or a lot in some cases, but the quality should still be there. On the long term, I think some research groups might indeed face some problems. With researchers being confined to their homes, laboratory bench work has been halted, making it difficult to comply with grant deadlines or resume work with salaries that are paid by grants. Thankfully, many private and public research funding agencies have already come forward with increased flexibility to researchers they fund, as well as extending or postponing deadlines to new research proposals. And it is my hope that the prospect of a long-term economic downturn doesn't change this, and that governments and policy decision makers, as well as funding agencies and charities, don't forget that scientific research has been laying at the forefront of our fight against COVID-19 since the beginning. I think researchers have witnessed different scenarios on social media since the beginning of the COVID-19 outbreak. At first, it was a very effective way to get up to date on the evolution of the pandemic at different parts of the world. And we got real-time information on what was going on in hospitals, the difficulties medical staff were facing, the efforts being put forward by different researchers leading to the creation of international consortiums aiming to know more about this new coronavirus, and so on. But the good thing about social media, and that is that everyone has access to it and you can find pretty much any type of information on it, can also be the bad thing about it. So indeed, the spread of misinformation on COVID-19 quickly became a global social media epidemic of its own. So from out-of-context information to miraculous treatments and conspiracy theories, you can find pretty much anything, in part because most social media platforms offer very little curation of their content. And this brings me to the scenario I think we're currently facing, with respectful, official, and prestigious individuals or organizations, such as the World Health Organization, working really hard to fight misinformation on COVID-19. And as a researcher, I think it is also our responsibility to have a very active role on social media fighting pseudoscience and misinformation. And this can be done by sharing or replying with evidence-based information, as well as regularly posting updates with links to trusted websites from research labs and scientific journals or official health organizations. At the same time, I think that researchers should tailor their messages to both the medical and scientific research community, as well as the general public, since the latter is the most likely to come across and reshare misinformation. I would even add that while sticking with evidence-based facts, one should also aim for positive and uplifting messages, including perhaps a more personal one once in a while. We have been living in isolation and with strict rules of social distance for quite some time now, with all the psychological tolls that it implies. And it always makes my day to see a worldwide renowned scientist that I admire post something so simple and unexpected, like today I baked a cake with my 5-year-old daughter, or uh, today I walked my dog around the neighborhood. So I think this is a really nice finishing example on how social media is having a good role, not only for researchers, but for everyone. I am really proud of the collaborative efforts that have been and continue to be implemented among the research community here in Portugal in order to support the medical workforce. Researchers have, for instance, developed a prototype ventilator using components of medical devices mounted as independent modules so that they can be readapted in the case of a stockout. Scientists and engineers are working in conjugation with the Ministry of Health to develop apps that allow for symptoms tracing and patient follow-up. Consortiums have been established between different research centers to design novel serological tests for COVID-19 to be used at the national level in epidemiological studies, but also to screen healthcare professionals who contact daily with COVID-19 patients and who might be asymptomatic, thus allowing for further disease containment. And several research centers, including our own, have redirected research activities towards the establishment of diagnostic units. So in our case, we here at the Faculty of Pharmacy and at the Research Institute for Medicine started by developing and validating a novel protocol for RNA isolation from patient samples at our biosafety level 3 facilities. This protocol is cheap, is fast, and does not rely on the availability of commercial kits whose stocks remain extremely low. We also further optimized and increased the capacity of the real-time RT-PCR step of the protocol. This was only possible due to the huge number of volunteers that committed early on with this project, and we got approval by the Portuguese health authorities to start the tests in the end of March. So since that time, we have established many protocols and partnerships with several local hospitals and clinics, and we are performing tests on a daily basis to provide relief to the public health system. More recently, we also established agreements with the National Pharmacy Association to test professionals from both hospital and community pharmacies, as well as with the Ministry of Labor, Solidarity and Social Security to test people in risk groups. So these are just a few examples of the many initiatives being led by researchers all over the country, and I am truly honored to be part of this community and thus help healthcare professionals in the front line in the war against COVID-19. I think the Portuguese government has been responding very well to the COVID-19 pandemic. Portugal declared state of emergency on March 18, and this was just 2 days after the first death was reported in the country. Individuals affected with the virus were required to undergo mandatory self-isolation, with the general population advised to stay at home unless strictly necessary. All schools and commercial establishments were closed. And in general, people obeyed the confinement measures, which I think helped to manage the coronavirus outbreak. Of course, resuming economic and social activity is vital. and the state of emergency was cancelled just recently, May the 2nd. And we are now in the so-called state of calamity, with scheduled release of restrictions and confinement measures in stepping phases to allow for readjustments when necessary. So, for instance, small shops have now opened, although social distancing measures are still in place and everyone has to wear a mask. But people can already practice physical exercise outdoors, for instance, use public transportation to go to work in cases where remote work is not possible, use public services upon appointment, and so on. So similar measures are being implemented in research institutes with the establishment of staff rotations, limited number of researchers per lab, and strict adherence to hygiene and sanitization measures as indicated by the health ministry. I think it's impossible to predict how will the pandemic evolve. This new coronavirus we are fighting against has many particularities that makes it difficult to give a straight answer, including its ease of transmission and its broad range of symptoms that can range from mild or even barely noticeable to potentially deadly. So in my opinion, it would be important for us to quickly adapt to this new reality of social distance, which for us Portuguese people could be quite challenging, I must say. But it's perhaps the only way that on the mid-term or a little bit on the long term, we can minimize further negative impacts on the economy while giving time for researchers around the world to come up with effective treatments and ultimately a vaccine to stop viral transmission. I think this pandemic has raised critical health, economical, and political challenges that will take time to resolve. For starters, we became aware of the shortcomings of healthcare systems worldwide, so we will need to scale up and the support to medical staff, which involves upgrading and readapting hospital infrastructures and operational procedures. We'll have to ensure that manufacturing capability for critical medical supplies is maintained, which demands for rethinking the model on how government should address public health issues. And in particular, I think that this model should contemplate development of new strategies for better data, evidence, and technology use in order to control future viral outbreaks and reduce its impact on health, economy, and society. And I think this is particularly interesting because we are witnessing how this pandemic is shifting research priorities towards the launch of clinical trials for new treatments and vaccines against coronavirus, and how healthcare professionals are working nonstop to treat these patients. And rightly so, of course, but this leaves important clinical trials for other diseases suspended, and the follow-up and surgeries of cancer patients, for instance, being delayed, which of course is not good. Within the research community, I think the importance of open research and sharing of data finally became clear to everyone. This has allowed for major breakthroughs on COVID-19 research that quickly translated to the benefit of society. For instance, sequencing of the SARS-CoV-2 allowed for the rapid development and implementation of diagnostic tests, while epidemiological studies have been helping to better track viral response and viral spreading. In this regard, the Portuguese health authorities have recently started to disclose COVID-19 patient data to the scientific community, and I hope this process is streamlined and made more efficient in the future. We also learned quite a few lessons from being in quarantine and working from home. I think we all gained much more appreciation from social professions that we took for granted, including childcare providers and teachers, supermarket employees, and so on. I think that these positions should be recognized as essential work when shifting priorities. Scientific meetings have been canceled worldwide, and this provided an opportunity to rethink the model and how researchers collaborate and engage with each other, with many congresses and conferences turning to online platforms, including EASL's International Liver Congress. I think with time we will realize that the balance between online offerings with physical meetings is actually a good approach, as it will allow for more accessible and wide-reaching scientific gatherings. EASL is actually a good example of that, as it has been significantly increasing the content of its open access e-learning platform EASL Campus, which I'm also collaborating with, and I'm really honored to be part of this initiative as well.